Give me a kiss. Say hello to people. Good boy. My name is Michael Strutt. I'm a physician working for Arias Physical Medicine and Rehabilitation. Today, I would like to speak about neck injuries. When you get into automobil trauma, the first thing you do, your head goes forward and backward. If you're a driver, you have a seat belt over left shoulder and lap belt over your pelvis. So when you move forward, you're not necessarily moving in straight fashion. You're moving first in sequence, like in the diagonal. So you go like this, and then you go like this, or you go like this, and you go like this. And first injury, it's a cervical spine. It's the most mobile. It moves in automobil trauma the most, no matter how much you restrict it. Usually, the number one area of injury in the cervical spine or neck is the cervical ligaments. You can injure, there's two types of ligaments. There's anterior longitudinal ligaments, and there's posterior longitudinal ligaments. When you perform the motion or backward and forward, you can notice the destruction force of the cervical, like I'm going to bring it closer. Destruction force, it's exactly what happened in your neck. The destruction force in between this vertebrae. And these ligaments, which located between this spinous process, is definitely going to get injured. Just after car accident, you don't feel pain right away. You just feel stiffness. What happens when you damage it, your brain detects the damage, saying your spine is unstable, so let's restrict it. And you have an immediate command to your paraspinal muscles, and that muscle is going to contraction. This is why you're moving. You feel this abnormal sensation. You're feeling very stiff. But that's what happens right after accident. Pain usually comes next morning. If you damage the ligaments in the posterior spine, posterior neck, what will happen is when you move forward, the vertebrae ball move one vertebra below more forward. So what they'll do, you see this? Structure which is called disc, it will put the pressure right on the front of the disc, anterior portion of the disc. What does it will translate to? That portion of the disc, right? Put like as a pressure here, and the disc will shoot back. So when you put pressure forward, push pressure backward, and that pressure of the disc will compress it with spinal cord, or it will compress with the spinal nerve. And now you're going to have pain down the arm. If you have damage to the upper cervical vertebrae, what will happen? It will compress this C1 nerve and C2 nerve. These nerves innervate your skull. If you do that, you have headaches. So that explains the pathology in a nutshell. Ligamentous strain, muscle sprain, and that's where you have pain, headaches, vestibular problems, and other problems like you might have problems with your vision or sensitivity to the noise. If you injure in a car accident, come to Arias Physical Medicine and Rehabilitation, 716-681-4088. Schedule a comprehensive appointment. We will evaluate you and will determine if you have a neck injury or other body part injuries. I have a special guest here. His name is Bailey, the therapy dog. He will involve in your rehabilitation process. He's a loving boy, and he wants to see you. Thank you, and have a good day.